I am Dr. Dibyajyoti Roy, practicing as a general practitioner in Murshidabad for the last 10 years. Today, we will discuss on the various aspects of gastroesophageal reflux disease, or GERD as we all know it. There are various, in day-to-day practice, it's very common to find people who have the most present with us symptom with bloating of abdomen or heartburn or even sometimes chest pain or sometimes belching. All these are rooted in the caused by several gastric uh, dysfunctions, mostly gastric related interruptions, which are mostly caused by gastroesophageal reflux disease. This reflux is which causes the most common symptom of this heartburn. Since we all know there are many PPIs or other several medicines to address this problem, but we can, other than medicinal, we should also look into the lifestyle modifications that help to elevate the symptoms, as only medicines cannot only reduce symptoms fully. So we'll discuss about the simple tips which will help us in this lifestyle modification to address the cause of GERD. Now, first we will understand about what causes this disease or the symptoms. The anatomy first. As gastroesophageal reflux disease is a common condition wherein the stomach acid frequently flows back into the esophagus, the food pipe that connects the mouth to the stomach, causing uncomfortable symptoms. So, in people with GRD, the acid reflux can lead to an uncomfortable symptom and irritate the esophagus, eventually causing health issues. In certain, it's been found that when after having a heavy meal or spicy meal, the esophageal sphincter is does not close or is sometimes damaged. Because of this, the acid which is present in our stomach goes back into the esophagus and causes this gastric irritation, which in turn is we feel as heartburn or fullness or sometimes even belching. Treatment of GRD usually involves medications to reduce acid and lifestyle changes. Dietary changes are the recommended lifestyle modifications for managing GRD, including changing what and how you eat. This can help reduce your acid reflux, protect your esophagus from damage, and relieve you from the bothersome symptoms. Now, let us know about some eating habits which need to be changed so that we may have less of these symptoms. Some eating habits can help manage GRD symptoms, like limit the water intake during meals, as it will increase water intake during meals will fill up the stomach and put pressure on the esophagus. Avoid large meals and late night eating close to bedtime, as lying down immediately after eating triggers heartburn. Lying down immediately after a big meal or having a spicy meal causes the contents to go back into the esophagus. This causes GRD. Eat slowly to avoid swallowing air, which can help reduce bloating. This also encourages you to chew your food more thoroughly, mixing it with saliva and improving digestion. We must try to eat small meals every few hours and avoid skipping meals and then overeating, which can worsen GRD symptoms. This approach helps keep your digestive system steady, like skipping a meal and making up for it in the next meal, like having your breakfast and lunch together or late lunch. This causes the acid to build up in the stomach, which again causes GERD. So we must always have small meals at fixed hours, and we should take care that we should not go hungry or empty stomach for a long time. We should also have drink lots of fluids, but not during meals, as it will help in it will cause the stomach to become full. Again, we will eat less, but our stomach, since our stomach becomes full, we'll feel more uncomfortable. Making healthier food choices can also help manage GRD symptoms and improve the overall digestive health. Now, some tips for this are: adding more fiber to your diet can improve digestion. Try to eat a variety of vegetables, fruits, and whole grains in every meal. Like during this modern times, we most of us have prefer fast food or food that is prepared quickly. In all this, we sometimes skip vegetables as they sometimes take longer to prepare. So we must always try to include fresh leafy vegetables which provide fiber to the content and help us in digestion and also avoid constipation and keeps our gut healthy. Choosing lean proteins such as chicken, fish, eggs, and plant-based sources like beans and legumes also helps in keeping the digestive system good. Choosing low-fat options such as lower-fat dairy products is advisable. We can include milk and yogurt that contain 2% milk fat or less, and also opt for cheese with 20% milk fat or less. As we know, the chicken and meat, all these are first class proteins and are needed for a healthy body, as they keep our body healthy and also help our body to grow. So when we include these meats, we should also take further precautions not to eat the fat, avoid the fatty foods. Use healthier cooking methods like grilling, baking, or steaming. Less oil is good for health, so steaming is best. Certain foods can worsen acid reflux symptoms, so you can consider limiting or avoiding them. These include alcohol, peppermint, caffeinated beverages such as coffee and tea, energy drinks, or soda. Sometimes patients complain that whenever they have tea, at that time they have this reflux or gastric irritation causes. So whenever is best to avoid milk-based tea and to go for black tea or have tea after having eaten something, not to have it on empty stomach. Citrus fruits and juices, tomatoes, chocolate, onion, garlic, and strong spices we should avoid as much as possible. Fried foods like French fries and snacks like chips, fast food items we should avoid as much as possible. Carbonated drinks, chewing gum, or using straws also cause increase in acid reflux as acid secretion increases after having a acidic based drink. Another important way to manage the diet is to keep a food record. Now, everyone has different kinds of cravings, and everyone has digestion of every food is different for everybody. Some have tried to cereals more or even rice more, others prefer wheat. Some has have allergic to allergens like milk, gluten. So everyone has different food triggers, so it is not necessary to avoid everything, but according to what your body takes. Some might not bother, some food might not bother, while some could mean missing out on important nutrients. It will be helpful to keep a food record to track what you eat and when you have symptoms, that as this can help you identify your triggers. So if we maintain a record and see that after having a specific food, the bloating or having these symptoms have increased, so we will try to avoid those foods. Also, maintaining a healthy weight is important in GRD. Excess weight can put pressure on your stomach. This can worsen symptoms like heartburn. Keeping a lean body and losing weight can help reduce the pressure and lead to fewer symptoms. It is also important to consult with a healthcare provider if symptoms do not improve only with diet and lifestyle changes. If someone has been taking acid reflux medicines for an extended period of time, these can sometimes interfere with the body's ability to absorb certain vitamins. So, if after taking medicines for a long time, these symptoms do not go, people should always consult with a doctor, as having prolonged use of these PPIs or any other anti-acid drugs freely available in the market is not good for the health. To sum up, choosing the right diet and following some healthy tips can manage GRD. Dietary changes are advised as key lifestyle modifications. So before medicine, we must always try to change our lifestyle and maintain a record so that we can observe the specific foods which trigger the symptoms, and we can always avoid those types of food intake. Having a calm and eating regularly without much tension. Tension also sometimes causes GRD. So having a calm lifestyle, not going is also helps in preventing GRD. But when the symptoms are prolonged and are not going soon, we should always consult a doctor. Dietary changes are advised as key lifestyle modifications, and adjusting what and how you eat can help protect the esophagus from damage, ease uncomfortable symptoms, and help you live with GRD. Sometimes if having prolonged GRD can always also cause cancer. So if these symptoms are prolonged, we must always consult with a health specialist, so we can so that further investigations can be carried out, and we must always treat GRD as like any other disease. Thank you.